So I'm glad to be here to talk about medications. Today's presentation is titled Taking Charge of Your Medications, What You Need to Know, and Tools That Can Help You. So I'm going to go through a few discussion points, but I encourage people to uh, uh, ask questions when we're done so that we can answer further questions. So, in terms of an agenda, what I would like to do today is talk about why we're talking about medications, the number of medications older adults take, what we mean by medications, why, when we talk about medications, we're not just referring to prescription and over-the-counter medications, but I use medications as a very broad term, and why we're talking about medications and the impact of our body on medications and medications on our body and the resulting side effects, drug interactions, drug-food interactions. And then we'll also talk about some inappropriate medications that as we age become more harmful than safe. And then we'll end the discussion with tools and tips that you can take away to use at home. So let's talk about why we're talking about medications. So on average, Canadians who are 65 years and older take about 7 medications per day. These are prescription medications. So 7 medications per day means multiple dosing times, multiple pills to take, and confusing regimens. And on average, we take 7 medications per day, or older adults who are 65 and older take 7. But if we look at a quarter of the older adults, they take 10 or more prescribed medications. And as I mentioned previously, this does not include medications such as over the counter that you can obtain from any pharmacy. And it doesn't include anything else that you may be taking, for example, natural health products or vitamins or minerals. So once we start adding those in, the averages go up even further and the complexity of managing medications increases. So when I talk about medications, what do I mean? I use the term broadly. Of course, there are prescription medications. These are medications that you can only obtain from a prescriber, and the prescriber can be a physician, nurse practitioner, or even a pharmacist, but they have to be prescribed for you to be able to get them and use them. Then there are over-the-counter medications. Over-the-counter medications refers to medications that you can get by yourself without the need of a prescription. So you can walk into a pharmacy. If you have a headache, you can go into the pain medication section. If you have a cough or cold, you can go to the cough and cold section aisle and pick up something for yourself and take it. Then we also have vitamins and minerals. So calcium, magnesium, all of the vitamins, they fall under this category. And then finally, I also want to talk about natural health products. These are products that you can obtain without a prescription. They're not regarded as medications, quote unquote, but they have an effect on some of the medical conditions we may want to treat. And these include things like ginkgo, ginseng, St. John's wort, saw palmetto, etc. I group them under all of these things under similar classes because for medication management purposes, for safety, for drug interactions, they're all important and they all contribute to one's health. Now, why are we talking about medications as we age? Well, it has to do with our changing body and the effect it has on medications and the effect medications have on us as we age and our bodies change. So what changes? Well, as I'm getting older, I'm realizing that I have more fat and less muscle and less water in my body. My kidney and my liver function, and especially so once I get to age 65 and over, may start to not perform as well as it did when I was younger. Another example is the junctions in the brain. So the brain has a sheath surrounding it. It's a sheath that has very tight junctions that's at all over different locations in the sheath. And these are there, and in our younger years, they keep us protected. They keep the brain protected from allowing all kinds of things to get into the brain. As we age, this sheath loosens a bit, and these junctions in the brains are not as tight. And so there is more potential for things to get into the brain, and more medications can get into the brain, and then they may stick around longer. So, what does this all have in terms of the effect on medications? Well, as medications are taken, if our gut has slowed down, they move through our gut slower. So, as they're moving through slower, there's more potential, a higher chance that more of it will get absorbed because it's there for a longer period of time. With the changes in our body and muscle and fat composition, fat, muscle, and water composition, drugs get distributed in our body differently. What does that mean? So drugs that like fat will go and sit in fat. In our younger years, we may have had less fat, but as we get older, there's more fat. So a drug that likes to sit in fat or is soluble in fat is going to hang around for a longer period of time and have an effect for a longer period of time. When we have less water, if we put a pill in a liter of water, its concentration is going to be in a liter. Now, if we put the same pill in half a liter of water, its concentration is going to be greater. So as we have less water as we age, the concentrations of our drugs also increase. Again, have more of an effect. And then finally, our liver and our kidney starts decreasing in terms of their effectiveness. Now, it doesn't happen equally for everybody. Everybody's different. Everybody ages differently. And so the effect will be different in everybody, but they do slow down over time. Our kidney is the one organ that eliminates all of the drugs that are in our body. And our liver actually metabolizes some of the drugs into products that the kidneys can then eliminate. So if they're both getting slower, the message is that drugs hang around longer. They may not get eliminated as faster or as efficiently. The liver may not metabolize or break down our drugs as efficiently or as well as it did. So the result is, through all of these processes, is that as we age, we get more sensitive to the effects of the drugs on our body. And we have more potential for them to cause side effects. But remember that I said on average, 65-year-olds and over take 7 medications. So all of these 7 on average are doing similar things. So now there is not only the potential for higher side effects, there's also the potential for these 7 medications to interact with each other and either cause less effect of some drugs or even more effect of other drugs. So there are certain medications that I want to hone in on because these are a little bit more problematic as we age. I have a few classes that I will go through. Now, just a note, I will list some of these medications and I'll mention why we're worried about using these as we get older, but that does not mean that you stop what you're doing. If you are on any of these classes of medications, the message is that you discuss the use of these medications with a healthcare provider. So either your physician, your pharmacist, your nurse practitioner, or your nurse, talk to them about these medications. Talk about what's happening, why you're taking, and if there are safer alternatives for the reasons that these medications are being taken. So the first one I want to talk about is the benzodiazepines and the non-benzodiazepine hypnotics. These are medications such as Ativan or Valium or Imivane, also known as Zopiclone. Often they are prescribed for sleep. So if you've had trouble sleeping, you go to someone, they may prescribe these to help you sleep. They're supposed to be used for short term, but sometimes inadvertently we may continue using them long term. Over long term, they cause significant problems with our memory. They may also increase our risk of falls and therefore also increase the risk of fractures. Another class of medications is anticholinergic medications. Now, I have some prescription and non-prescription medications listed under this category. A prescription medication is Elavil, also called amitriptyline, and some non-prescription medications or over-the-counter medications include Benadryl, Unisome, Tylenol, PRN. This class of medications is also frequently in nausea and allergy medications, in cough and cold medications. We call these anticholinergic because of the way they work in our body. Cholinergic neurons are very important for memory. So if you take something that's anti-cholinergic, then they're going to affect our memory. They may cause things like confusion. Not only that, we have effect in other parts of the body. They may also cause constipation, dry eyes, dry mouth. They may cause problems with urination. Often, when we obtain these over the counter, we're trying to treat things like trouble sleeping, nausea, allergies, cough or cold. They can also be used for mood, though. Another problematic class of medications are pain medications or analgesics. Examples include common ones that we obtain over the counter, such as ibuprofen and naproxen, but they also include opioid medications and also Tylenol. Tylenol is in over 600 medications over the counter. So sometimes what happens is we obtain two products. We don't realize that they both have Tylenol, and we're taking one product to treat one thing and another product to treat another thing. And ultimately, we may be ending up taking more than 3 grams per day of Tylenol. More than 3 grams per day of Tylenol can be detrimental to our liver and can affect our liver. Similarly, things like ibuprofen, naproxen, they have a potential to increase blood pressure. They affect our kidneys, they affect our heart. They often cause bleeding in the stomach, especially if they're taken over long periods of time and for very high doses. So again, these are medications that we often use to treat headaches, general pain, arthritis, but it needs a discussion with our family doctor, our pharmacist, or our nurses to determine what doses, for how long, how do we come off of it, what is a long-term plan to treat those conditions. The last one is the opioid medications. Opioid medications are notorious for causing constipation and confusion and should also be used with care, and especially with care as we get older. Cough and cold medications, pseudoephedrine, that is also an ingredient in a lot of cough and cold medications. They can increase blood pressure. They also cause sleepiness and shakiness. Dextromethorphan, if we take it for a long period of time, higher doses can cause confusion and irritability. And even medications that we used to think were pretty benign, like antacids and dyspepsia medications, we've now discovered that they interfere with the absorption of vitamin. For example, vitamin B12 in people who are taking long-term antacids and PPIs may be decreased because it affects the absorption of vitamin B12. I also want to mention natural health products. Often we think because they're natural, they're safer. And they could be, But we have to think about these as medications as well because they can cause problems. In my practice, I've frequently encountered patients who be taking natural health products for long periods, higher doses, and they present with problems. Some that can worsen side effects, for example, ginkgo, fish oil extracts, St. John's wort, they can interact with blood thinners, prescribed blood thinners, or even aspirin, and increase the risk of bleeding. So they add on, they kind of work together and increase our risk of bleeding even more. St. John's wort is notorious for interacting with almost so many medications on the market. So if we're taking St. John's wort, we have to make sure that it is safe to take with other medications. And then there are others like saw palmetto, ginkgo, that we are not as effective as we were believed or we were made to believe in terms of our memory or benign prostatic hyperplasia. Glucosamine and chondroitin I've listed for osteoarthritis. There is evidence showing that it is effective, but again, we need to use it carefully. I also want to talk a little bit about drug interactions. Um, I already talked about them a little bit with some of the previous slides, but some foods and medications can decrease the absorption of medications. For example, calcium interferes with thyroid medications and how well the medication works. Some food and medications can interfere with the breakdown of medications, and as I mentioned, they then increase the side effects or make medications less effective. A well-known fruit that interferes with the medication is grapefruit, and often we tell patients about the grapefruit and atorvastatin drug interaction. And some medications work together to increase either the effectiveness or the side effects. So aspirin and ibuprofen together can increase the risk of bleeds. Now, let me just end the presentation with a few tips. So if you're going to go to your doctor and your pharmacist, make sure you take an updated medication list. This should include all your prescription and over-the-counter medications, any natural health products you're taking, and any vitamins you're taking. And make sure that you list the name, the dose, how, and when you take it, and update the list whenever there's a change. So if there's a new medication that's added, if a medication is discontinued, or if there's a change in the dose. Keep an updated list of allergies and what happens when you take medications. For example, such and such medication caused me to have hives or caused me to become short of breath. Also keep a list of side effects for medications. So such and such medication caused a stomach upset, and that, the symptoms of that were like burning or nausea, etc. Whenever a new medication is being prescribed or you're thinking about starting a new medication over the counter, ask about if it's a new prescription medication, the name, why it's being prescribed, how long you should be taking it for, how many times you should take it in a day, when in the day you should be taking it, how many pills you should be taking at each time, whether you need to take it with food or if you're supposed to separate it from food, what to expect from it. Why are we using it? What should I expect? By when should I expect this effect? What side effects should I be watching out for? Which ones are okay and tolerable? Which ones do I need to address with a healthcare provider? If it interferes with anything that you're already taking right now, when should you stop it? How should you stop it? Should you be coming off slowly and taking it, cutting down slowly over a period of time, or can you just stop it the next day cold turkey? If you need refills, and what you should be doing or not doing when you're taking the medications. So, for example, driving, and also what you should do if you forget a dose. Can you take it with the next dose, or should you take it as soon as you remember? Those are all good questions to ask. Talk to your pharmacist, especially about all your medications, including prescription, over-the-counter, natural health products, vitamins, and minerals. Mention any allergies that you have, any side effects, or any concern that you have with drug interactions. If you have trouble with organizing your pills or remembering to take them, or if you have problems opening blister packs or opening bottles, talk to your pharmacist. If you have problems with swallowing your pills, ask them what can be done. Should you cut it? Should you crush it? Should you mix it with something? If you have trouble reading and understanding the labels and you don't quite know what the instructions are saying, talk to them about storing your medications, traveling with your medications, expiration dates, and when the next refill is, and how to find out on the label where to look for how many refills you have. Store your medications in cool, dry places because light and humidity affects the stability of medications. Refrigerated medications should be stored in the refrigerator. Keep them out of the reach of children, especially if you babysit, neighbors, children, kids, grandkids. And store medications. Keep them where you can see them so that it helps you remember to take them. And one final note about organizing and dispensing and taking medications. This can be quite a challenge, especially if you get to 7, 8, 9 medications. It can become quite complex. So there are a number of technologies and non-technology solutions that you can apply. I've listed some. I won't go through all of them because I want to stay on time, but there are several different products on the market that you can try to obtain, and they will help you stay on your medication regimen or adhere to the medication regimen. I have some online resources here that you can access to find more information about medications. And with that, I will thank you for listening to me while I talked about medications. And I will stop sharing now so that we can have a conversation.